Yeah, so this one's for the ladies. Declines in mental sharpness and cognitive ability are common in old age, but start sooner in women than in men. Dr. Rob is in the house. He's got tips to keep the fairer sex outsmarting their partners. I like that.
That's the way it needs to be.
Well, I mean, I think we outsmart them anyway, but we could always use a little boost.
You do.
At least he admits it,
that's
right?
true. Like, you guys have all the power. You just don't know it.
Yeah, well, some of us do.
Yeah, some of you do. I think you do, for sure. So, but one of the alarming things is when it comes to neurocognitive decline, Alzheimer's, Parkinson's, the neurodegenerative diseases, women tend to enter into those problems a lot sooner than men.
Why is that?
In their 40s and 50s. No one's exactly sure if there's a genetic role or predisposition to something, but it's true. About 1 in 6 women will get one of these neurocognitive diseases like Alzheimer's or Parkinson's or cognitive decline. And there's a lot more that you can do for this early on than you can do later when you actually start to show the symptoms of these diseases.
So you want to start in your 20s, 30s?
Yes,
okay.
Exactly. Or definitely in the 40s. And there's things that you can do, and we're going to give you tips today on how you can prevent that neurocognitive decline.
I like that.
One of the best things to do initially is actually to be screened. And the test is really simple. It's actually done on a computer. And I think we have a graphic today of here is actually a neurocognitive evaluation. You can see on the far right of your screen, we've got that red box and all the X's in the red column, and that shows all the memory and verbal problems that this individual is having. And they're not very old. I think they're only in their 50s, and they're already showing signs of incredible decline in their cognitive abilities. And you know, when you lose your mind, and we all have family members or know somebody that has either Alzheimer's or dementia or some neurocognitive disease, and it's terrible. Their body might be functioning well, but their mind is gone. And it's really quite terrible. But there's things that you can do to help improve that and mitigate it.
Okay.
And the big one is exercise. Our bodies were designed to move, and a lot of people, as they age, they stop moving.
Yeah.
You need to keep moving, keep all those powerful hormones, and endorphins, and everything that helps clear the body of radicals. Got to keep moving.
Okay.
Meditation.
Meditation is
Recently had a client, she's 89 years old, sharp as a tack. And I asked her, I said, how is it that, you know, what do you do that makes your day, how do you stay so sharp? She told me she starts her day by spending it with a friend, and their whole goal for the first hour after they awaken is to laugh for a whole hour.
Hey,
and
that
then
sounds like
later
a
in the
good
day, she meditates for a half hour to calm her mind.
And you said 89.
89,
hey,
sharp as a tack.
She knows best.
Yep.
Learning new skills.
Learning new skills.
You hear this a lot.
Yeah, we've all heard, you know, you can't teach an old dog new tricks. Well, that's not true when it comes to human beings. You want to keep your mind sharp, you need to learn new skills, whether it's doing crossword puzzles, tackling mathematics, something that challenges the brain.
It doesn't have to be like skiing. It's just something that challenges, like you said.
Got to keep your mind active, whether it's reading, writing, some form of mental activity. When it comes to supplementation, fish oil, without a doubt.
You hear all about this
One
all
of the
the
most
time.
powerful anti-inflammatories that you can use to decrease inflammation in the brain, in the central nervous system. The component that you want to make sure your fish oil has is DHA.
Yes.
And there are formulations that are purely DHA, and I like the concentrations that are 40 to 1.
Okay.
Those are proven to decrease the inflammation most powerful in the brain.
Okay.
Next
Almost out of time, but
hormones.
yeah, I want to make sure we get those.
Yeah, hormones. And there's a lot hormones can do early on, but if you already have the disease like Alzheimer's or dementia, not so much. So it's early on when those levels get lower that you need to replenish them.
Okay.
Of course, eat plenty of leafy greens. Leafy greens help secrete nitric oxide, which helps keep the arteries healthy, so it decreases the incidence of heart attack and strokes. Women have those at a rate after 40 of about 1 in 2.8.
My goodness.
Yep.
All good tips. These are really, really good things and great recommendations on the supplements and what we need to do. RenueHealth.com, the place to go, and we can ask for you. Thanks for being here.
Wonderful to be here again.
All right.